Imagine a non-surgical procedure for symptomatic BPH that's minimally invasive in men for whom drug therapy, for example finasteride, is typically indicated. That's always been too much to ask, until now. Today, America's 4 million BPH sufferers have a fresh alternative: the Prolieve thermal dilatation system. It's an effective treatment for symptomatic BPH that employs prostatic dilatation in concert with computer-controlled transurethral microwave technology. This leading-edge system effectively relieves the symptoms of BPH in a single outpatient procedure. Thermal dilatation system lives up to that mission and offers BPH sufferers a treatment option. The Prolieve system is a self-contained, computer-controlled unit designed to treat symptoms of BPH right in the doctor's office or clinic. The Prolieve system employs a dual-action technology that combines microwave energy with a prostatic dilatation balloon to compress and treat the prostate. The results have been exceptional, as most patients in the pivotal trials experienced little or no discomfort during the procedure, and 82% of patients were catheter-free following the procedure. During the procedure, a single-use catheter is inserted in the patient's prostatic urethra, and a Foley-like anchor balloon is inflated at the bladder neck. The thermal dilatation balloon is inflated to dilate the prostatic urethra and compress the prostate before microwave energy is delivered to the targeted prostate tissue. Begin by connecting the microwave cable to the back of the unit. Next, connect the rectal temperature monitor using the up arrow on the right side to confirm that you're plugging it in properly. Now plug the power cord into the wall. Turn the safety key to the horizontal or 3 o'clock position and switch the power button on the back of the unit to on. Allow 1 to 2 minutes for the Prolieve system software to load. A diagnostic summary window will appear and must display all OKs before you can proceed. Advance to the next screen by using the left touchpad button to click OK. You'll quickly master the touchpad if you've never used one before. The pressure of your fingertips on the touch surface moves the cursor across the screen. The 2 buttons on the bottom of the touchpad serve the same functions as the left and right clickers on any 2-button computer mouse. After you click OK on the diagnostic summary window, the program will go to the Prolieve system main menu, where you'll click Treat Patient. This will take you to the Welcome to Treatment Setup Guide window. Begin by confirming that New Patient is selected and click Next. At the Patient Information window, fill in the required fields utilizing the keyboard. You can change data fields by using the touchpad or simply press Tab to move to the next field. At the Treatment Protocol window, select BPH from the drop-down menu with a single left touchpad click. Then click Next. In the Notes field, you can fill in any information that the physician feels is necessary to record, for example, the patient's prostate size, PSA, peak flow, etc. Click Next to continue. Remove the catheter box and scan its serial number by holding the box so that the label is vertical and about 6 to 12 inches from the barcode reader, located on the front of the console. Click Scan to activate the barcode reader and align the red laser light with a longer barcode. Then click Scan again when you're ready to repeat the process for the HXC box. If the barcodes don't scan, you can manually input the serial numbers utilizing the keyboard. After both serial numbers have either been entered or scanned, click Next. You should double-check the patient information and treatment parameters for accuracy and completeness. When finished, click Next. This will bring you to the Fluid System Preparation window, where you should take a moment to finish setting up the Prolieve system. Remove the HXC from the box and insert it into the HXC slot on the console. Each HXC is disposable, so you will not need to save it after the procedure. Insert the HXC tubing into the pump head. Be sure that the tubing is seated in the V-shaped notch on the console so that the tubing isn't pinched when you close the pump head cover. Spike and hang the sterile water bag on the knob along the side of the console, then go back to the screen and click Next. You're ready to fill the HXC with sterile water. To fill the HXC, simply open the blue clamp on the tubing and close the white clamp. Then click Next. The heat exchanger will begin to fill, and you'll hear the pump making a light clicking sound. After a minute or two, an on-screen prompt will appear to inform you that the HXC is full. Click Next to continue. Now it's time to prep the catheter. Begin by opening the catheter pouch from the connector end, being certain to leave the balloon end of the catheter in the pouch to preserve its sterility. Let's take a closer look at the catheter's components. On the connector end, you see the bladder access port, the fluid connector, the anchoring balloon inflation port, and the microwave cable connector. Moving down the catheter, you see the catheter position marks to visually confirm proper positioning throughout the procedure. Continuing along the catheter, you see the prostatic compression balloon and the Foley-type anchoring balloon. At the distal end of the catheter, there is a coude tip with a channel for bladder access or a guide wire if required. You should test the anchoring balloon for leaks by inflating it with 5 cc of sterile water via the anchoring balloon inflation valve on the catheter's connector end. Then deflate the balloon by simply retracting the fluid. Finally, to remove air from the fluid system, begin by closing the blue clamp and then detaching the HXC fluid connector from the sterile water bag. Now reconnect it to the catheter, open the white clamp, and click Next. The system will take about 30 seconds to remove any air from the catheter. You will be prompted to click Next when it's ready to go. In order to properly position the rectal temperature monitor, the physician will digitally dilate the anal sphincter and perform a digital rectal exam to measure the distance from the center of the prostate to the anus. Prior to insertion, cover the rectal temperature monitor with a condom and lubricate the condom thoroughly with KY jelly. Insert the rectal temperature monitor with the black numbered markings facing up to the pre-measured depth determined during the physician's digital rectal exam. This will position the monitor's 3 temperature measurement locations at the center of the prostate, an insertion of normally 5 to 8 centimeters. Prior to inserting the catheter, apply 20 to 30 cc of KY jelly or lidocaine jelly into the urethra, being certain not to use any petroleum-based products. Lubricate the catheter and insert it through the urethra into the bladder. If necessary, an 025 guide wire may be used to place the catheter. Once in position, inflate the anchoring balloon with 5 cc of sterile water. Different methods, such as ultrasound or palpation, may be used to verify the proper location in the prostatic urethra. Once the anchoring balloon is seated, adjust the penile marker ring and note its location. This marker can be inspected throughout the procedure to verify that the catheter has not moved. Attach the microwave cable to the connector end of the catheter. On the treatment screen, you'll see the pump speed and water pressure section. Click Forward to begin to increase water pressure in the compression balloon. Continue to click the plus button slowly, about 1 click per second, while monitoring the patient's comfort. Let the patient know that he will begin to feel internal pressure as the balloon expands. Continue to inflate the balloon slowly while monitoring the water pressure until it reaches 15 psi in the gauge's green range. Now you're ready to start the microwave heat delivery. Ensure that the microwave safety key is turned to the horizontal or 3 o'clock position. Then initiate the procedure by clicking Start. A window will appear to prompt you to turn the RF on by clicking the RF on button, located at the top of the display. A red light above the microwave safety key will illuminate, indicating that the system is ready to deliver microwave heat. The physician initiates the delivery of microwave energy by clicking the Start button. Notice in the temperature display that the FWD, or forward power, is increasing along with the rectal temperature. These are levels that you'll want to monitor throughout the 45-minute procedure. At the conclusion of the treatment, the microwave power will automatically turn off, and instructions will appear on the screen for you to first close the white clamp and then restart the pump by clicking the Forward button. Increase the catheter water pressure to 9 to 11 psi by clicking plus until the pump speed is 10. Then stop the pump and click Start. After 5 minutes, the screen will prompt you to release the white clamp and click Next to run the pump in reverse. This will deflate the compression balloon and end the treatment phase of this process. Guidelines will appear on the screen, directing you to first disconnect the microwave cable from the connector end of the catheter. Next, disconnect the HXC fluid connector. Next, fill the bladder with 200 cc's of sterile water or saline and deflate the anchor balloon. Finally, remove the catheter and rectal temperature monitor, then shut down the software by first clicking Close and then clicking Exit. It is now safe to power down the console using the on-off switch on the back. Help the patient to his feet and ask him to void. Many patients will experience immediate positive results and void successfully, while a minority may have difficulty. If this is the case, the patient may need a Foley catheter. This is the time for the physician to prescribe and explain any post-operative medications while answering the patient's questions and addressing his concerns. The entire procedure is complete and the Prolieve thermal dilatation system is ready to perform another procedure. This concludes our instructional demonstration of the skills and techniques you'll need to effectively use the Prolieve thermal dilatation system for treating symptomatic BPH.